Hey, everyone. Thanks for joining today. My name is Dee Dee Gardner. I'm the Chief Research Officer at the Allergy and Asthma Network. Welcome to this afternoon's webinar. We're in for a great treat today with Dr. Anil Nanda as our presenter today. We do have a few housekeeping items before we start today's program. First of all, participants will be on mute for the webinar. We will record today's webinar and post it on our website within a few days. You can find the recording of the webinars on our website at allergyasthmanetwork.org. Scroll to the bottom of the page to find our recorded webinars and any upcoming webinars. This webinar will be 1 hour, and that includes time for questions. We will take those questions at the end of the webinar, but you can put your questions in the Q&A at any time. The Q&A is a box at the bottom of your screen, and we have someone monitoring the chat if you have any questions or need any help. We will get to as many questions as we can before we conclude today's webinar. The Advances webinar is in partnership with the American College of Allergy, Asthma, and Immunology. The college offers CMEs for physicians and attendance credits for everyone else. You can create a free college account and obtain CME or attendance credits through the member portal for Advances webinars. All attendees will be offered a certificate of attendance. No other continuing education credit is provided for anyone. A few days after this webinar, you will receive an email with supplemental information and a link to download the certificate of attendance. We'll also try to add the link to the certificate in the chat while the program is taking place today. So let's get started. Today's topic is marijuana use and asthma, risks and considerations for users. As cannabis use becomes legal in more states, many people are seeking it out for medical and recreational uses. According to the Allergy and Asthma Network's Pain, Exercise, and Cannabis Experience survey, many people with asthma are smoking or vaping cannabis, which can be harmful to their lungs and airways. We also learned that doctors and patients need to be better educated about marijuana use and its potential health benefits and risks. In this webinar, you'll gain a comprehensive understanding of how marijuana use can affect those living with asthma. It is my pleasure to introduce our speaker, Dr. Anil Nanda. Dr. Nanda is an experienced board-certified physician who takes pride in his work, helping his patients, giving back to the community. He is a member of the clinical faculty in the Division of Allergy and Immunology at the University of Texas Southwestern Medical Center in Dallas, Texas, where he teaches and mentors physicians in training to be allergists. He completed his allergy specialist at the famed National Jewish Health Center in Denver, Colorado, which is consistently rated as one of the top-ranked respiratory hospitals in the country. Dr. Nanda believes that spending time and listening to his patients is extremely important. All patients are treated as individuals with personalized treatment plans, and he strives to answer those patients' questions personally to discuss all test results with them. Dr. Nanda is the past president of the Texas Allergy Asthma Immunology Society and the past president of the Denton County Medical Society. Thank you for being here, Dr. Nanda. I'll turn it over to you.
Sure, I appreciate it so much, Dee Dee and everybody. I really appreciate the Allergy and Asthma Network, the college, the American College of Allergy, Asthma, Immunology, and all my colleagues, all our patients that are joining us, people that are joining us, all healthcare professionals, including physicians. So again, thank you so much. I'm actually on the job right now. I'm in my office. I'm actually in a patient exam room because there's other patients in my my office right now, so I'm kind of holed up in an exam room, but it's great. So again, I see patients, right, and this the topic is really excellent and really, as Dee Dee was saying, it's just really timely, right? And patients mentioned it. Patient this morning mentioned it right here in this office, in this exam room. For my disclosures, really, I have no relevant financial relationships to disclose or anything with this. And next slide. So learning objectives, I want to explain the respiratory effects of cannabis smoking and its implications for asthma management. Adapt asthma management plans to include cannabis-related risk assessments and questionnaires, of course. Integrate strategies to counsel patients about the risk associated with cannabis use related to asthma management. And not only that, I also want to talk about cannabis allergy. Being an allergist, immunologist, people have allergic reactions to cannabis and other potential issues with cannabis, respiratory issues with cannabis that I think as healthcare professionals we should all talk to our patients about, and for patients to learn about also. So you get some bonus coverage here. So really excited about this talk. And next slide, please. So cannabis, otherwise known as marijuana, I mean, it's approximately 192 million people. It's probably an underestimate. About 4% of the global population use cannabis sativa. It's used, as Dee Dee had mentioned in the introduction, right, both medically and recreationally. It's estimated that consumption is increasing, especially in adults over 50 years of age. And again, people are living longer and longer. So again, this is going to be used, but it's used by all ages, basically. Um, Including teenagers. So just be aware of that, right? It's the third most potentially psychoactive substance used worldwide after alcohol and tobacco. Next slide, please. So United States, legal issues. It was legal actually in the U.S. Prior to 1937. There was the 1937 Marijuana Tax Act that prohibited marijuana. So again, it goes back a long way. It was classified as a Schedule I substance in 1970. Still is federally, actually. And 1996, medical cannabis was legalized in California. In 2012, recreational cannabis was legalized in Colorado and Washington, and has been legalized in other states as well. But that's a little bit of a timeline. Next slide, please. So cannabis plants, Cannabaceae family. You have a picture of it here. Cannabis sativa is the more common kind of genus and species, but Cannabis indica is also there and is really growing in prominence. And as a matter of fact, when people go to local and anywhere in the country, or even a lot of tough places in the world, you have the cannabis stores and CBD stores. We'll talk about they have some both cannabis sativa related products and cannabis indica. So just be aware of that. And there are others too, but these are the most common ones. Next slide, please. So THC, so delta 9 tetrahydrocannabinol, or THC. I'll say THC for ease from now on. But that's the psychoactive effect of marijuana, and it causes euphoria, relaxation, also delusions and psychosis. So be aware of that. It's a fast acting, right? The THC compound is a chemical, is fast acting. It reaches the brain in about 30 seconds. Peak concentrations in blood in about 4 to 10 minutes. And the psychotropic effects can last up to 2 to 3 hours. So again, it's fast acting and can last for a while. So just be aware of that. It's about 15% of the proportion in cannabis usually. Greater than 0.3% THC is a class 1 controlled substance in the US. And then cannabis containing less than 0.3%, we'll see on the next slide here in a second, but that's kind of the non-psychoactive components. So the legal cannabis is with the non-psychoactive effects is the less than 0.3% THC, and that's an important point. That 0.3% is kind of that borderline. Above that, it's more psychotropic, psychoactive effects. Less than 0.3%, it doesn't have much psychoactive effects or addicting effects. Next slide, please. So marijuana, hemp, cannabidiol, cannabis plant derivatives are considered marijuana if their THC concentration is more than 0.3%, what I just mentioned. If the concentration is less than 0.3%, the plant is considered hemp. So you may have heard about hemp oils or hemp products. Again, it's less than 0.3% THC, or at least supposed to be. So be aware of that. Cannabidiol, or CBD, I'll call it CBD from now on, like CBD oils, things like that. It's a derivative of marijuana. It's less than 0.3% THC. So next slide, please. So again, CBD, it's a non-psychoactive product. It's found in oils and other products. And this is the one that we see a lot, right? That are sold online in retail stores, across the country and in many parts of the world. Again, it's from hemp. It's less than 0.3% THC. So again, just to emphasize that point. Next slide, please. So some FDA approved uses of marijuana. This is not an exhaustive list, but just some examples. Dronabinol is a human-made form of THC. It's a Schedule 3 drug that treats nausea and vomiting caused by chemotherapy, and also is used for to treat weight loss in patients affected with HIV or AIDS. Nabilone is a synthetic cannabinoid or cannabinoid. It's a Schedule 2 drug used for treating chemotherapy-induced nausea and vomiting, and is widely used for chronic pain management. And again, these are again less than 0.3% THC. Epidiolex is a CBD oral solution. It's limited to patients 2 and older. It's approved by the FDA in 2018 for treating epilepsy. So these are the products that you can actually find in pharmacies, in regulated pharmacies. That's FDA approved. These are FDA approved, so you can find in regular pharmacies and things across the United States. Next slide, please. So uses of CBD oil. It's been used to reduce seizures, managing anxiety, some neurodegenerative disorders, pain relief. It's been used for acne treatment and also cancer treatment. So a lot of uses, and these are just some examples, but this is what's heavily marketed. And there's some evidence actually that it does help this and help patient symptoms with these ailments and conditions. Next slide, please. So some side effects, right? I mean, there's no such thing as perfection, right? Every medication or everything, even everything over the counter, has positives, benefits and side effects and risks. So just be aware of that. And this is something that we should tell our patients, and our patients should know. Our members, of the Allergy and Asthma Network should know. It can cause depression, been associated with depression, CBD oil, dizziness, hallucinations, low blood pressure, and there's some evidence of withdrawal symptoms such as irritability and insomnia. So just be aware of the side effects of CBD oil. So just because it's over the counter and you can get it at your local, cannabis store or a retail store around the corner, doesn't mean that it's totally safe and without side effects. So again, mention this to our patients. And next slide, please. So consumption of cannabis, different, right? It can be eaten, it can be injected, inhalation. We're going to talk about that, especially with the risk with asthma and implications for asthma. And again, inhalation, either smoking or vaping, and that's unfortunately pretty popular now. Vaping products, including cannabis, including in our younger populations, teenagers. So it's a big issue. Next slide, please. So this is just an example, and it is in black and white, but how it's used inhaled, and the different products that are out there, different things that patients talk to us about, right? So if you don't know, this is actually a nice guide. A joint for example, a joint is a cannabis that's rolled in a paper and smoked. Blunt is a term for emptied cigars in which the tobacco is actually replaced with cannabis. Spliff is a mix of cannabis and tobacco mixed and rolled in paper. A bong is actually smoked while dragged through or drawn through water. Vaporizer, again, let's talk about vaping. It's heated below burning temperature and smoked. And a hookah, we've seen these at restaurants and other nightclubs and things. They're very popular. Cannabis is mixed with flavored tobacco over charcoal, and smoke is drawn through the water. So kind of similar to a bong a little bit in that both they're drawn over water. But and there's others too, but these are just some examples of how marijuana or cannabis is smoked. And it's important to understand when a patient says yes, they use marijuana or smoke marijuana, ask them, how they use it. Like, for example, if they use it with a hookah, they're getting tobacco exposure too, which has a lot of risks, as we all know, right? So very important in the history. Next slide, please. So smoking cannabis, it's usually smoked with larger and more prolonged inhalations than tobacco, so be aware of that. It's usually smoked without a filter, so you get about 4 times the particulates compared to tobacco. There's usually no nicotine in cannabis, so just be aware of that, as there is in tobacco. But again, it's not safe. Marijuana or cannabis, it does share with tobacco it has carbon monoxide, ammonia, hydrogen cyanide, acetaldehyde, formaldehyde, phenols, polycyclic, aromatic hydrocarbons, and heavy metals, cadmium, mercury, lead. It takes me back to my chemistry classes, right, and organic chemistry classes, talking about this. But what's the issue with these compounds, these chemicals, is that they are known to cause cancer. So again, marijuana is not the, it's, smoking it's not the most healthiest thing to do, and it's associated. It has agents that cause cancer. Now, there haven't been any studies, at least that I'm aware of, showing smoking cannabis only leads to cancer as tobacco. But the risk is there, and I would tell our patients that. So just be aware that there are cancer-causing chemicals in cannabis, especially when you smoke it. You do also get 3 times more the tar in the respiratory tract, has been shown, compared to tobacco if you smoke marijuana. So again, it's not a totally benign thing to do as it's marketed as. There's a lot of side effects, especially in our patients with respiratory conditions, including asthma. Next slide, please. So some pathology on cannabis smoking. I know there's some physicians, and healthcare professionals listening to this, but and for patients too, I think it's good to know. There are higher rates of bronchial wall thickening, bronchiectasis, and mucus impaction compared to tobacco smokers. Again, it's higher compared to tobacco. There's some basement membrane thickening, goblet cell hyperplasia, squamous cell metaplasia. Squamous cell metaplasia, again, is kind of a precursor to cancer. Be aware of that. Basement membrane thickening, we see that with our asthma patients. So it's definitely some pathology with it. And there's some elevated levels of pro-inflammatory cytokines, so pro-inflammatory proteins, really. So it's been associated with a lot of inflammation, the cannabis smoking. So next slide, please. So clinical effects, right? How do patients feel? We talked about the pathology under the microscope, what happens. So clinical effects, there are higher rates of coughing, wheezing, sputum, hoarseness compared to the general population. There's the rates of respiratory symptoms are comparable actually to tobacco smokers. And actually, it's been shown in some studies that cessation of cannabis, stopping cannabis smoking, reduces respiratory symptoms. So be aware of that. I think it's a good thing to counsel our patients. Next slide, please. So lung function, again, there is a little short-term, I just highlighted here, a bronchodilator effect, meaning it opens up the lungs a little bit. And again, it's just a short term. So just be aware of that. Sometimes people would look at that and they go, oh, it's helpful for your lungs, or it's, quote, marketed as, quote, good for your lungs, and that's absolutely not true. So there are effects to it. Or detrimental effects, reduction in lung diffusing capacity, increased resistance, which is not a good thing in the airway, lung hyperinflation, which we see in emphysema and COPD conditions. There is, so that's an issue. There is right now no evidence that cannabis smoking leads to COPD, but again, there's not much data or studies out there because it's a controlled substance. It was an illegal substance for so many years, so there's not a lot of studies on it. But again, as I just discussed, right, there's a lot of detrimental effects, under the microscope in the pathology of the lung, on the respiratory symptoms, and actually lung function as we're seeing here. Next slide. So marijuana smoking with asthma. So cannabis smoking or marijuana smoking, you can use those interchangeably. It's a risk factor for increased use and filling of asthma medication. So that's been shown in studies. Observational studies have shown an increased prevalence of asthma among marijuana smokers. And it is a precipitating factor for a poor asthma control, actually, a precipitating factor for asthma, the studies have shown. And again, this is something we need to discuss with our asthma patients. Next slide, please. And again, I know a lot of questions are coming in, but we'll have some time to answer that, so it'll be great. Absolutely. And I appreciate everyone interacting. I really like this to be interactive, and no questions off the table. So definitely look forward to that discussion. So other lung conditions, right? Again, this is the Allergy and Asthma Network, but there are other lung conditions, right? There's bullous lung disease, primary spontaneous pneumothorax, which is basically lung collapse. It's associated with that. Marijuana smoking is associated with that. It's lung collapse or pneumothorax, combined tobacco marijuana smoking actually increases the risk. Um, it's interesting, Aspergillus fumigatus. So it's one of the molds, a very common mold that's found indoors and outdoors. It's a big outdoor mold, and it's actually been shown to be on. It's one of the most common mold or fungus spores to be on cannabis crops. So there is potentially, they're looking at an association between, or at least a theoretical association between pulmonary aspergillosis, a lung condition, and an infection of the lungs, basically a fungus infection of the lungs, with cannabis. So we're just kind of looking at that. Again, it's not a not a benign crop. Okay, so be aware of that. There's some questionable, interactions or potential interactions with or causes with marijuana, linking marijuana with Legionella pneumonia, tuberculosis, even COVID-19 pneumonia, right? COVID-19, right? Since 2020 or late 2019, there are some associations with marijuana and COVID pneumonia. We just don't have the data yet. That's why I put question marks there. Again, lung cancer. Again, there are cancer-causing chemicals in marijuana. There is an acute lung injury that can occur in vaping, tobacco, or marijuana. Be aware of that. And there is a potential cardiovascular risk in patients who use marijuana, who smoke marijuana in particular. Next slide, please. So, I want to transition a little bit. We talked about the asthma impacts of marijuana, lung, respiratory impacts, but there is, cannabis allergy, right? Allergy to cannabis. It's an immediate type hypersensitivity reaction or a type 1 reaction. There have been case reports of any route of ingestion, smoking, edibles causing allergic reactions to cannabis. Again, just like anaphylaxis, right? Allergic hypersensitivity reactions or cannabis allergic reactions or anaphylaxis. It's a rapid onset, like we see as allergists, immunologists in clinic all the time. It affects upper lower airways, nasal passages, conjunctivitis. You can get wheezing, shortness of breath, urticaria, angioedema. We see that a lot with anaphylaxis, and it's been and cannabis allergy. It's been shown that 20% of patients with cannabis allergy have experienced anaphylaxis. And usually, the definition of anaphylaxis is two or more body systems. Like it can't just be skin, but skin plus lung or respiratory issues, or stomach issues, GI issues, is the definition of anaphylaxis. But again, that 1/5 of patients have experienced anaphylaxis, so be aware of that. And we'll talk about that with the treatment and epinephrine and things like that, for allergic reactions. Next slide, please. So cannabis adverse events versus cannabis allergy. I think this is important for us as healthcare professionals to tease out in the history. Adverse events, anyone smoking marijuana, again, you can have clear eyes, dilated conjunctival vessels. But with allergy, if you have allergic reactions, it's itching. You have a lot of itching, and you'll see that. Sometimes just smoking cannabis, you're not allergic to it. You have nasal congestion, stuffy nose. But again, itching, that's one of the things that can interact a little bit with it, and it can show that it's more of an allergic reaction. There's usually no mouth itching in when you're smoking cannabis or eating cannabis usually. There is a syndrome called cannabis hyperemesis. It's just vomiting when taking marijuana. You want to, again, with your history and physical, as a healthcare professional, kind of look at, is vomiting, is it anaphylaxis, is it allergic reaction? And usually, again, if patient presents with urticaria and angioedema, right, hives or swelling or anything, that's usually more of a cannabis allergy. So again, just an example of compare and contrast the adverse events or just side effects of cannabis versus a true allergic reaction. Again, on the bottom here, cough, wheezing, shortness of breath. Again, it can be an adverse event, right? Anytime you smoke anything, right, tobacco or anything, you can have cough and things. So, but again, cough, that can be the start of an allergic reaction. So again, tease that out with your history. And there is some data showing that in patients who have drank alcohol or exercised or used, non-steroidal anti-inflammatory medications like ibuprofen and things, using it within, like an hour or two or within a time period of using cannabis have shown potentially more allergic reactions to cannabis. So keep that in mind, definitely, in your history when you're taking your history uh, with our patients. Next slide, please. This gets into a little bit of the details, but I think it's important. Component resolved diagnosis. Again, a lot of us on here are healthcare professionals too, and it's important for patients to know, right? That the protein. Usually, if you're allergic to something, it's the protein, like a food or a plant and things. It's the protein of the food or plant or um, CANS3 is the cannabis sativa non-specific lipid transfer protein. So it's basically the protein that's majorly what's been identified as people are allergic to in patients with cannabis allergy. I think it's important, and I'll talk about this in the upcoming slides. But CANS3, it does share the same molecular features with other transfer proteins from other plants and other foods. So we'll talk about this kind of food allergy, cannabis association here in a second. A couple of other proteins that have been postulated to be identified in cannabis allergy, CANS2, CANS4, and there's this rubisco, ribulose 1,5. Again, I'm back in chemistry class. Ribulose 1,5 bisphosphate carboxylase oxygenase, or rubisco. I like rubisco better. It's easier. It reminds you of Nabisco, right? The cracker company. But that's another potential allergen that you might see in the literature, especially as a lot more research is going with on cannabis reactions. Next slide, please. So as I mentioned, I teased this, right? Cannabis-associated food allergy. There's a cross-reactivity, as I mentioned, between non-specific lipid transfer proteins, the CANS3, and some plants and some fruits. And it's been associated, patients sensitized or to CANS3 can develop allergies to a wide variety of foods that share that same protein. That lipid transfer protein, including fruits, vegetables, cereal, some of the fruits that are there and vegetables. I know there's a debate, right? Is tomato a vegetable or a fruit? But I won't get into that now. But anyway, tomato, kiwi, banana, citrus, grapes, peach. Peach was actually the first one. It was back in 2007, one of the first one to be associated with cannabis allergy and peach allergy, because you're sensitized when you ingest or smoke cannabis, you can have these reactions. So just be aware of that in the history. I think that's very important as we're seeing patients in the office. There is some cross-reactivity between these proteins in barley and grapes. And so they're thinking, again, some case reports, but they can cause reactions to wine and beer, just to alcohol. Be aware of that. And again, as I mentioned, these reactions to these proteins, it can occur with exercise, been associated to occur with exercise, non-steroidal anti-inflammatories like ibuprofen, things like that, or alcohol. So be aware of that. Next slide, please. So other cannabis-related allergies. And this is stuff that's marketed, right? We see this all the time. Hemp seeds, actually seeds that grow into the cannabis plant. They are high in protein, and they're high in omega fatty acids. There's a low THC count, and there's a high CBD oil count or product in it. But it's been marketed as kind of as being healthy. Because of these traits, the protein, the omega fatty acids. But case reports have shown allergic reactions to hemp seeds, so be aware of that. And occupational exposure to cannabis, right? If you're in law enforcement, there's other if you have a store, selling cannabis, again, it may cause sensitization and you may be more prone to allergic reactions. As well as non-allergic, right? We went over the adverse effects of cannabis, so be aware of that. Next slide, please. So allergy testing to cannabis, I'm just going to be very brief here. I mean, there are some allergy tests. It's more in the research setting, at least in the United States, and we're going to go over this next slide, but there's not any standardized test or anything commercially available. It's in the research setting, but there's skin prick testing, what we do for the pollens and the inhaled allergens and foods, specific IgE, it's the blood test, right, to the protein, to either the whole extract hemp or cannabis, or to CANS3. And there's also on the research setting in allergy immunology, there's basophil activation tests and mast cell activation tests. But again, it's in the research setting. I just want to emphasize that. Next slide, please. Again, issues with testing, I mentioned this, right? In the United States, at least, there's no commercially available standardized testing in the US. Skin testing with extracts, again, it's still a federal one, Schedule 1 fairly classified substance. Theoretically, patients can bring in their marijuana. You can skin, prick the marijuana or kind of, dilute it down and prick it. But again, there's no standardization. And again, they're legal issues, right? So just be aware of that, because every state is different. I'm here in Texas, and California laws and Colorado laws are different from Texas, right? In Texas, it's not recreational legalized. It's just for medical purposes. But yeah, next slide. So again, cannabis challenge. We talk about food challenges in the office, and challenges to insect stings sometimes in the research setting and things. But again, they're legal issues, right? If you're allergic, you tell someone to come in and smoke cannabis in the office. Again, there are legal issues with that, it's tough. It's tough to do again in the office, right? It's just a lot different from the food challenge. And the other thing I think just to be aware of, both as patients and talking with patients, is cannabis in commercial stores, right? All these stores that we see, mom and pop stores or big stores at the corner of everywhere, a lot of places in the US, there's unknown amounts of THC, and there's unknown amounts of CBD, and we don't know how pure it is, right? Sometimes marijuana can be mixed in with other things. Unfortunately, tobaccos, things like that. Unfortunately, other drugs, LSD, cocaine, things like that. So there's just a lot of issues, unfortunately. And so just be careful. Tell our patient, just because someone says that their CBD is quote unquote pure or 99% pure, whatever it is, the regulation, there's not a lot of regulation, and it's still ongoing, this federal and state regulation, and it differs in each state. So just be aware that you get cannabis from a store. Again, if you get it from a pharmacy, if it's an FDA approved medication, like for glaucoma and things, and it's in the pharmacy, yes, it's gone through FDA standards. But if it's at a local store, you don't know the amounts of THC or CBD in it, or what it's mixed in. So just be careful and really counsel our patients on that. Next slide, please. So treatment, there's not a lot, for treatment of cannabis allergy. It's avoidance is the main thing. Again, if you're worried about anaphylaxis, and epinephrine auto-injector, I think is important. It is interesting, omalizumab. There's a case report of omalizumab or Xolair treatment for a patient who had cannabis allergy, and they, again, it's off-label. It's an off-label use for omalizumab. Not FDA approved, but it was used in a patient with cannabis allergy, and they didn't have any reactions. And omalizumab is currently approved for food allergy, FDA approved for food allergy. It's also used for asthma, right? It's also used for severe asthma, and it has other indications like urticaria and things. And again, I put question mark at the bottom here, desensitization protocols. Again, we desensitize to medications. There is some desensitization, both FDA approved and off-label kind of desensitization things for foods, or oral immunotherapy, things like that. But it's still kind of in the infant stages. There are some, I think, studies that are going on currently in Europe. And again, in the US, it's a Schedule I substance, so there's not a lot of there's research being done, but just not a lot of data in the US. Most of it's from Europe. And next slide, please. And other countries, of course, around the world. So talking with patients about cannabis, and this may be a little bit older slide set or data, because I think it's used now, but cannabis is still federally illegal. I'm not sure what, with the new administration, if that's going to change, but it is illegal right now, as far as to my knowledge, federally. But medical use is legal in 40 states and counting, and recreational use is legal in 23 states and counting. So be aware of that. States have different laws regarding cannabis, including indications for medical use. So again, patients may not be willing, right, to honestly answer questions about their cannabis use. I'm in Texas, where it's not recreationally legalized. Patients may be more hesitant to talk to me about it, as opposed to Colorado or Washington State, where it's been legalized since 2012, for recreational use. And again, laws are evolving, so check with your state's current laws on cannabis. And next slide, please. So talking with patients about cannabis, again, open-ending questions, very important. You want to incorporate cannabis use questions with the same vigor as we do as healthcare professionals with a history of tobacco, alcohol use, which we ask all our patients. Um, there's a cannabis intake form. I'll talk about that here in another slide. We did some with the partnership with the college, the American College of Allergy, Asthma, Immunology, a cannabis modules on cannabis and cannabis allergies. So there's some intake forms from there. Again, no judgments. I think that's important. You want to be an active listener and also be open to learning about cannabis and how and why your patients are using it. So I think that's the main thing. I think, as a physician, and a lot of us are healthcare professionals, and we're all in different fields and things. I always looked at myself. I'm always a student, right? Even though I've been I'm not going to say how long I've been in practice for. I'll just say a couple of years, maybe, right? But yeah, I'm always a student. I always consider myself a medical student and always learning. So I'm really learning and open to learning about different conditions, including cannabis allergy. Absolutely. Next slide, please. So again, you want to just kind of more details here on talking to patients about cannabis. And patients, please, be open with your physician about it. I think as physicians, I like to say all of us, but I'd say, vast majority, most of us, we want to help our patients, right? So please be honest with your physician. We're trying to improve ourselves, not be as judgmental, and we want to really improve our history taking and things. So be open with your physician. We can really, I think, help out and kind of ask questions. Don't just ask the person who's checking out, when you're, if a patient's buying something cannabis product at the local CBD store, yes, they have some information, but talk to your healthcare professional, right? Talk to us as healthcare professionals. We're here to help. But you want to adjust questions according to the patient preference and tone. Leave time for questions. I think that's very important. Again, a lot of us, health professionals are rushed and, we're behind and our bosses, are who are oftentimes not physicians saying, oh, we got to see more and more patients and this and that, and we have less time to see patients. But just leave some time for patients. Even 1 or 2 minutes can make a difference. And I think as one thing, as allergist immunology specialists, we tend to spend more time with patients than other specialties. And we respect all the other specialties, but I think one thing I'm really proud of being an allergist immunologist is we spend a lot of time with our patients. And I think that's great. Patients appreciate it and it's really helpful. Answer questions as best you can. Again, I don't know is a perfectly valid answer. Again, I'm always a medical student. I'm always learning, and so I think it's important. If you don't know, I admit. I say, hey, I don't know, but let me look at that for you. Let me check on that for you. Let me research that question you have, and then I can answer it. And again, as I mentioned, take time to research patient questions and concerns. Next slide, please. So the college cannabis, the ACAI cannabis education modules, we have some helpful links here. There's the Allergist Foundation of the college, 6 CME modules on cannabis allergy, talking to patients about cannabis. They have the cannabis questionnaire. That's at the college. You see the website there. And then there's a micro CME, cannabis and the allergist. I think you have about approximately 6 units of CME with that. And then there's the International Cannabis Allergy Collaboration, which is the college is part of, again, the American College of Allergy, Asthma, and Immunology, and the European Society and of Allergy, Asthma, Immunology, and the Canadian Society of Allergy, Asthma, Immunology. So they're all very involved in international collaboration to learn more about cannabis allergy, and to use it to help our patients. Next slide, please. So I want to thank all of you. I know I was very, I guess you could say, brief or quick, or I like the word efficient, right? So I like to leave time for questions and things, but and a discussion from all of you. But I want to thank, of course, the Allergy and Asthma Network, the American College of Allergy, Asthma, and Immunology, and the college's dermatology committee. I'm currently chair of the dermatology committee of the American College of Allergy, Asthma, Immunology, and also the integrative medicine committee. Again, I mentioned in the previous slide the international cannabis allergy collaboration with the different societies. The United States is the American College, the European Academy, and the Canadian Society of Allergy and Immunology. And then, one of my attendings, Dr. William Silvers, he's a pioneer in integrative medicine. He's allergist immunologist. And he actually led was one of the leaders in the effort to put together the International Cannabis Allergy Collaboration. So I want to just acknowledge Dr. Silvers, and I just want to acknowledge all of you. Again, we're all colleagues, and I think we learn from each other, and it was great. So I'm going to turn it over to the actually next, yeah, question answer. So, I'm the original Anil Nanda. So you see Anil Nanda at yahoo.com. There's no dots or anything in my name. Again, the original one. So email me if you have any questions or anything, or after this webinar, let me know. And yeah, we got some time, I think, for questions. So, and a great discussion. So.
Great. We have a lot of questions.
Of course. Oh, that's great. A lot of engagement. I love it. Absolutely.
Great. So we have from Karen. She's asking, she's a school nurse and she's seeing
Sure.
many students who have imminent
Sure.
vomiting post use of the immediate and long-term effects of the dabbing of cannabis. Could you speak to this on what are the side effects that we should be, or
And so I'm kind of a nerd a little bit. So dabbing, is that kind of like dipping kind of thing, or is it like tobacco dipping, like chewing it kind of thing? Or
you've got me.
yeah,
I
see,
have
dabbing,
not
I
heard
know,
of
I don't
dabbing.
know. So but again, I'm learning here. So
Yes.
but it's an issue, right? There's different methods, right? The inhalation, edibles, eating it,
Yes.
chewing it,
Yes.
things like that.
They say
I
it's a
see
it's a
here.
concentrated oil, like a wax.
Okay, okay. So yeah,
Smoky.
I mean, there's definitely side effects on that. I'm not aware of why, is that in particular a dapping or dabbing, more associated with nausea vomiting than ingestion or inhalation. But I think it's just important to to tell our patients, that it's not this kind of, as the marketing and social media is saying, it's kind of this benign thing. It's not. And then particularly, as a school nurse was saying, right, teenagers and even younger than teens are even using it. Unfortunately, they get it from their parents potentially or others. It's marketed as a very benign or a kind of a benign thing, but it's not. As we just discussed, a lot of potential side effects,
Right.
including allergy, asthma, respiratory issues, definitely.
Yep. Okay.
Great question.
Thank
Thank you.
you.
Yeah.
Yeah, it is a good question. It stumped me.
Yeah.
So we do have a couple others that are asking
Please.
about the volume and frequency of inhaled cannabis versus the volume and frequency of it being compared to tobacco. Are they equal 1-to-1, or is there a different volume?
It's interesting, we don't know. We're getting more data on that because in tobacco smoking, it's pack years, right? One pack is 20 cigarettes or approximately 20 cigarettes, and you smoke for a number of years. So we're able to, in research studies, say, hey, this is like 10 pack years of tobacco or 20 pack years of smoking or whatever it is. We don't have that with cannabis right now. So that's a great question because a lot of the research studies, it actually says how much are you using cannabis. It's kind of right now what the research what the research is saying now, at least in their papers, is high, moderate, or low, and there's no standardization. High is smoking marijuana approximately 4 to 5 times a week. Moderate is maybe once a week, and low is maybe once or twice a month. But it hasn't been shown, even just like we say, when someone smokes a cigarette, a tobacco cigarette, for the first time, they cough, and that's kind of a sign that it's a lung irritant. Same thing with cannabis and marijuana smoking. But we are working on standardization. I think in a few years, as more research gets developed and things on this, it can be more standardized. But great point. Great
All
points.
right. Another concern or question is thinking about second and third hand smoke when it comes to
Sure.
tobacco. Is there something similar to this exposure for people who are smoking cannabis? But the second part of this is wearing a mask. Would that help to diminish the exposure?
Yeah, great. I think, I think wearing a mask can help diminish, just like with the pollens, and things that you say as an allergist, right? You're mowing the lawn, you're allergic to grass, masks can help. It's not perfect, right? So masks are not perfect. Even the N95s, they're good, but not perfect. So I think masks can be helpful. Um, it's difficult. It's one of those second and third hand smoke, or secondhand smoke in particular. Yes, there is evidence that yeah, any kind of exposure, can cause those, respiratory symptoms and lung damages. So I think just to be mindful, just like I tell patients to be mindful of other family members, for example, parents who smoke, whatever it is, cannabis, tobacco things, to be mindful of smoking around others in the family, but kind of same thing. I think it's best to avoid it if possible. But it's difficult. I mean, sometimes you're at a concert or something, or I mean, it is hard. But just remove yourself from the area, because I think as patients know their bodies the best, right? They know kind of what triggers, and all the time I see patients every day, including today. Just any kind of perfumes or anything, they know there's stimuli, they know
Right.
what happens, and they know what they need to avoid, so kind of avoid that environment if possible, that kind of thing. So yeah.
Yeah.
Right.
So you did make mention about occupational exposures.
Sure.
Do you have suggestion if a person has respiratory disease like asthma who is working in a plant on how to protect themselves? Or
Yeah, absolutely. No, I think definitely. I think definitely see you. First of all, I want to see your asthma specialist, right? You want to see your allergist, immunology's asthma specialist. And I think being up to date with your medications. If you're on, what I see a lot of times with patients with asthma, unfortunately, is everyone reaches for their albuterol and their short acting inhaler, which is good bronchodilator, but it just doesn't have any anti-inflammatory effects, and they stop their controller medications, the inhaled anti-inflammatory. So I would say keep on your asthma medications. Again, masks can help. There's not a lot of great data. Does it help or not? But I think masks can help a little bit. And of course, if it's not really smoking it. I mean, if you're in a plant or something, potentially, yes, there are some vapors and things potentially, but wearing gloves and things, or not latex-free gloves preferably, but gloves, to reduce exposure, it can be helpful. But I think I consult your allergist immunologist for further details on that. Definitely. It depends what exposure you have. Absolutely.
are you familiar with a stepwise approach to trying to switch a patient from inhaled cannabis to edibles or something else to where they're not inhaling? Is there like a stepwise approach to do this? Because some people are saying in the chat on the questions that
Sure.
some patients have had success, but others are not having success. And so is there any information that you could share with the group?
Yeah, I'm not aware of any, at least there's no standardized kind of stepwise approach of going from, inhaled, right, to edibles. But I think just like smoking, I mean, it's hard to kind of quit, quote, all right, cold turkey, right? You kind of reduce, and I think as physicians and healthcare professionals, I think that's where we can just kind of be a coach and be an advocate for our patients, saying, hey, it's hard to quit all at once, but at least reduce it. Just like I tell patients with my, who are smoking tobacco, they were on a pack a day, now they're up to one or two cigarettes a day. I commend them for that. I'm like, hey, that's reducing. Let's further reduce. So I would probably say just just be encouraging, and just applaud them for trying. At least they're talking to you about it, number one, and trying to quit, trying to reduce it. So I think that's great. And again, edibles, yes, you're not going to have the inhalation, the respiratory issues. But again, as I mentioned, there's cancer causing agents and marijuana and things. So just, it's not the safest thing either, So, again, unless you're taking one of the FDA approved, where we know the amounts and things and all of that, just be careful about the edibles. How pure are they? How much THC do they have? There are side effects from edibles too.
Yep,
So just be aware of that. Yeah, definitely.
yep, yep. Do you use pheno as a test to determine, is pheno available to inform us? Are those values elevated if a person is using inhaled cannabis, or are we aware of this at all?
Interesting. Yeah, pheno is excellent. So pheno is fractional excretion of nitric oxide. It's basically a marker of inflammation, of allergic, usually allergic, or we would call type 2 inflammation. And a lot of times in patients with asthma and certain types, it's not all inflammation, but certain types of inflammation, it's elevated. And with tobacco smoke, it can elevate pheno. Sometimes viruses can elevate pheno. But it's a great question. I'm not sure how marijuana smoking, if it elevates pheno or not.
Okay.
But I would say in those, and I use pheno in my clinic all the time. I
Mhm.
would say if you're having a patient, if you're looking at pheno levels in a patient, kind of the same. If they're above 40 or 50, that tends to be more inflammation. So you want to put them on an anti-inflammatory controller medication, like an inhaled steroid. So it's a good marker. But again, it's not complete. Pheno is important. I do pheno along with pulmonary function testing or spirometry. But of course, the best test is history and physical. And I think just remember to ask questions about cannabis and cannabis smoking and things, because a lot of times people ask, oh, do you smoke cigarettes? And the patient's like, no, never. Like, oh, let's go to the next question, or how many pets do you have, or whatever. As an allergist,
Right,
we always ask that, right?
right.
Cats or dogs. But stop and
Yeah,
say, hey, I usually say open ended. Do you smoke anything? Do you
right.
smoke anything? So I think that's very helpful. But great question on pheno. I like it. Bring up pheno.
Yeah.
Yeah.
I like the fact that you're having an open-ended question versus being very specific to only tobacco use, because even, when we think about tobacco use and people, when they're dipping or using some of these other pouches, if you ask them if they smoke tobacco, their answer is no, but they're
Or
still using.
dapping. We learned the term dapping, right,
Yes,
Dee Dee? Both of
yes,
us.
we
So
did.
you got that. That's great. Or
Yeah,
dabbing,
we're
I'd say.
dabbing. Yes,
Yeah,
we've
dabbing.
learned dabbing today.
Yeah.
We have a number of questions that are, very specific to dosing and again, switching from cigarettes. People are utilizing vaping as a possibility of reducing their cigarette use. You know, any any thoughts here on
Yeah, and
one
again, I
over?
think that the main thing is, yes, applauding our patients on reducing, smoking and for anything, tobacco, and they're going to vaping.
Yeah,
But just counsel patients that, yeah, vaping, there's not, as much nicotine. But there are bad chemicals in there too, and some cancer-causing chemicals in vaping also. So yes, I would say this. How I would approach it, just seeing a patient is, yes, you're going from cigarettes to vaping. That's a positive step, I'd say. But then go from vaping to not vape. I mean,
yeah.
just keep encouraging them. I think that's key, because again, marijuana, cannabis, CBD,
Mhm.
um, vaping, they have side effects and issues, but they're marketed, right? You look up social media, TikTok, Instagram, Facebook, whatever social media platform, it's marketed as they're kind of quote healthier, and that's an issue. So I think just reminding patients that no, vaping is unhealthy also. So just kind of remind them of that. But great point.
Right.
Yeah.
Right. And we have a number of school nurses on our webinar today that have
Yeah. I
pretty
appreciate everything that
specific
you all do. That's
questions.
great.
Yeah,
Keeping our students safe
no,
is awesome. Appreciate it. Yes. Thank you.
absolutely. And they have some, pretty specific questions to
Sure.
their community, right? On
Please.
helping kids understand what the side effects are. You
Sure.
made mention about anaphylaxis or allergic reactions. Could you speak to that just one more time, a little bit more about the allergic reactions to inhaled or edible cannabis?
Yeah, no, definitely. I mean, typical allergic reactions, you have itching, rash, hives, those kind of things. So I would say in a patient that presents that way, at least include it as part of your history. A lot of people, they think, oh, you came from the cafeteria or whatever, right? In school, it's a food, it's always, and a lot of times it is a food, right? but you never know what they're doing. Maybe the high school kids or something. You don't know, right? So I think it's just important to ask about that. Smoking cannabis, was there edible cannabis, and any of this stuff. But allergic reactions are definitely out there, and itching is one of the things that kind of differentiates a little bit, because usually allergic reactions are itchy. If someone has a rash and it's not itchy, a lot of times it's not allergic. It's not 100%, but it's not allergic if it's not itching. So I think that's kind of the key. And I think I just want to emphasize, to your audience here, and again, really appreciate the school nurses. But the treatment of choice for allergic reactions, the first line treatment of choice is epinephrine. It's epinephrine, intramuscular in the thigh, and I think just to mention, don't hesitate to use epinephrine. My rule of thumb of epinephrine is, if you're thinking about it, you're like, is this a bad reaction? Is it, should I use epinephrine? Should I not? Go ahead and use it to be on the safe side, because epinephrine is very safe, and I think the main side effect of epinephrine is it's adrenaline, right? So it's kind of like a strong cup of coffee. You may get a little jittery after using it, but that's it. So there's sometimes a fear of using epinephrine. Oh, they have to go to the emergency room or all this or that. But I think using epinephrine early actually is very helpful, and it's very safe to use. So don't hesitate to use it. And definitely, yeah, that's what I would say to that. Definitely,
Great. So the last question,
sure.
what effect does the heating from vaping have on the lungs themselves? Are you able to address that?
Yeah, I don't know. Great question. I just don't know what effect it's not a good effect. I'll say I can guesstimate that. I think but a lot of times sometimes vaping heating it tends to release some chemicals sometimes. So it's not a good effect. So there's everyone's everyone's trying to always say what's the safest way to use it, safest way to use it. And yes, there are some safer ways, right? Not smoking it's better. But again, there's risk in using it. So I think that's something to mention to our especially our recreational users, saying, yes, there's some, relaxes you and things like that, but there's some negatives, right? Definitely medical negatives and rebound effects and withdrawing and withdrawal effects, things like that. So just be aware of that. And I think it's great as healthcare professionals, to just mention that and educate our patients about that. So yeah.
Thank you. Well, thank you, Dr. Nanda, for your
Sure.
presentation today. This has been extremely informative, and we all have learned some new things
Sure.
today. Um, For the audience, you'll receive an email from Zoom in a few days with a link to this recording, an evaluation, and supplemental resources. We have 2 webinars coming up in February. The first is another installment of our Black People Like Me webinar that will address barriers in eczema care for the Black community. Join us on February 11th at 4 p.m. when we'll welcome Dr. Amaya Alexis to discuss disparities that are persistent in eczema care for that community. The patient, Greg Clark, will also participate and share his experience, his lived experience with eczema. Then on February 25th at 4 p.m., we will welcome Dr. Niraj Patel for another Advances webinar discussing the microbiome and its role in asthma and allergies. Thank you all again for joining us here at Allergy Asthma Network, where we work every day to be your trusted resource for people with allergies, asthma, and related conditions. Thank you all.
Appreciate it. Stay safe, everyone.